All right, well, welcome everyone. My name is Michelle Taylor, and you have joined Fairport and Luma Wealth, our Wealth and Wellness series. Today is on sleep. We actually do have one more that's coming up this year that's going to be on women's financial fitness, which is on November 6th. So we encourage you to also join us for that. A couple of housekeeping items before we get started. You will see that you have a question box. Please, if you have any questions, we will be taking some questions throughout today's workshop, and we'd love to hear from you. As we go through this unusual time, I think it's been kind of an extreme with the economy, the markets. We've also seen this shift in personal and emotional well-being in 2020. And I think it's a bit ironic because we had talked with Dr. Todorov about 12 months ago, and who would have known that we would have ended in this pandemic and a time where we have had a lot of shifting on the personal and professional levels. And just a reminder for everyone, we do actually have the sleep change or the time change this weekend, so we all fall back. So that's going to add another thing that we have going on that will disrupt our sleep. But without further ado, we are certainly excited to have Dr. Irina Todorov here with us today. She is from the Cleveland Clinic with Integrative Medicine, and her mission is really to inspire and empower people to achieve their optimal physical, mental, and social well-being via their lifestyle and changes that they are going through. She currently helps patients really incorporate different evidence-based nutritional changes, manual therapies, and mind-like meditation and breathing exercises into their daily routine to help them live that better life. She also is the interim chair of the Cleveland Clinic Department of Wellness and Preventative Medicine, and interim medical director for the Center for Integrative and Lifestyle Medicine. So Dr. Todorov, it's truly a pleasure to have you here with us today. I'd love to turn it over to you, as I'm sure that, including myself and everyone on here, we cannot wait to hear what you have for us today. Doctor?
Yeah. Thank you for having me. So we can advance the slides. It was a real pleasure to talk to all of you. Next slide, please. Okay, so today my goal is to kind of review how much we have to sleep, why the sleep is important, and also looking at what we can do to improve the sleep. And I divided it in a group of like tips, like what we need to remove, maybe that is on our way to get a good night's sleep, what we need to add, like what's missing, for example, stress management, sleep ritual before sleep time, and so on. And also very quickly we'll go over some sleep disorders for which you might need to be evaluated by physician. Also I've seen a lot of patients taking supplements, so I'll review the most common I see people take. So next slide. So again, what is a sleep? So sleep is a state marked by lessened consciousness, lessened movement or skeletal muscle, and slow down metabolism. So pretty much everything slows in the body. And so how much do we need? Based on the different recommendation, different societies, it's as a general rule, I say you need to sleep at least 7 hours. So 7 hours or more. Next slide. So many people do report having problems with sleep. 15 to 20% of the adults experience like acute problem sleeping. For example, oh, you cannot sleep for a couple of days, or something happens at work, and so on. While the chronic insomnia disorder is something that needs to be treated, and 6 to 10% of adults are affected by that. In the next slide, I will go over a couple of reasons for acute or adjustment insomnia. So for example, think of the time that you have to present something, or you have to have a yearly evaluation, or you're giving a lecture and you might not sleep well that night. So this is kind of adjustment. You're starting a new job. Let's say I'm traveling, taking the plane at the times when we are traveling. So, you know, you make sure you wake up a couple of times to that you're on time. Also, you know, like financial hardship can lead to acute insomnia, career problems, losing job, new job, having a health problem yourself, waiting for lab results, results, waiting for a family member to have a surgery or something, relationship conflicts. Next slide, please. And these are usually subside in a couple of days after the event goes better. Well, again, chronic insomnia is much more kind of severe, and it's a disease, and it's when you cannot sleep for at least 3 nights every week for at least 3 months. And not only that, like, oh, I cannot sleep, but I can function, I don't have no problem. So most of the time, insomnia is also you have you're feeling tired. The next day you cannot perform. You're like avoiding doing things, going with friends, and pretty much doing the things that you want to do during life, and so it affects your lifetime, events and things you do. Next slide. So here I wanted to differentiate what is insomnia and what is a sleep deprivation. So to have a sleep, you need two things: sleep opportunity and sleep ability. So when most of you and some of you have kids and they're small, so you wake up a couple of times and you have to wake up and you take care of that one. Or you are working as shift worker, you work at nights, or you have to give a big project and you have to work until 12. So if you go to bed, you're able to fall asleep, no problem. So that's a pretty much sleep deprivation. So that's not a disease. That's, you just pretty much have to figure out the right time to get enough sleep. And while insomnia is when you have all the opportunity on earth, like you have the bed, you have the room, the temperature, everything is perfect, you have the time, but you're just laying in bed and you're kind of, I have to sleep, but you can't fall asleep. So that's truly what insomnia is. Next slide. And with this, I'll talk a little bit about the shift workers, night shifts. They have been studied actually pretty extensively, and they have a higher risk of mental diseases like stress, anxiety, depression, and this is all because of that interrupted sleep, social problems, the actually smoking, the divorce rate, errors at work, and accidents are much higher, and also there is higher number of heart disease and gastrointestinal disease in people who work shifts. And working shifts, like let's say if somebody says I'm working night shift for the last 20 years, your body kind of adjusts, versus if you're somebody like when I was a resident, you're working day, the next night, then the next day, then second shift. So it's much more difficult to switch between different shifts. Next slide. And so the next two slides will be like some tips for the night shift workers. So the first one is at work, and the second slide is at home, what you can do. So a couple of things. So first, don't overuse the caffeine, especially in the last couple of hours before you go to, you finish your shift and you go home, because then you're not going to be able to fall asleep. Take some short breaks. So for example, jumping, walking, getting outside, on a colder temperature. Have a buddy, like, so you watch each other, and if you see like the other person starting closing their eyes, just say like, take a break, do something, walk a little bit. Again, taking like a very fast breath, like actually helps you to wake up a little bit. And also schedule things that require your full attention at the time of the shift that that you're not sleepy. So for example, many people say around a night shift, like around 2 to 4 o'clock is the times that like they're naturally sleepy. So if you have to prepare meds for the nurses and everything, try to get everything ready ahead of time. Next slide. So also when you go home, you have to create all the environment kind of to help you fall asleep. So for example, like I was working night shifts, you go home and like there's somebody call on the phone or somebody come at the door. So make sure everybody, the whole family, like, the most likely people who can call, they know your schedule, then they know when are you going to sleep. If there is like, adults or older kids, you can put the do not disturb sign at the door. Make sure you turn off your phone, unless you're waiting, or you're on call or something that you need to turn it on. Make sure that the room is like dark, quiet, temperature is good. So if you need to get like a earplugs, wear the eye mask, buy like extra dark drapes, it might help you. Next slide. So also, you know, we mentioned these are the shift workers, but if you continuously do not sleep well, you know, and we're talking about not like one night, 1 month, 3 months, but like for years, that does increase the risk for, you know, medical conditions like diabetes, heart disease, anxiety, depression, and mental disorders. Again, the anxiety, depression. In one meta-analysis that included 16 studies. So meta-analysis is if you look at different research studies, you put them together and you combine the results, so it's actually more validity of the results. And in that study showed that the people who are sleeping less than 7 to 8 hours a night increase the overall risk of death by 12%. So again, always we say, like, you know, think of if I give you a pill and that pill will increase your decrease your risk of dying with 12%, would you take that pill? So that's the sleep. And the next slide, I will talk about accidents and how people react when they're sleepy versus alcohol. So people with mild to moderate untreated sleep apnea perform much worse than people who have an alcohol level of 0.06%. So again, almost 20% of all the serious car crashes in the general population are associated with the driver sleepiness. And on the next slide is actually interesting study when they took a volunteers, you know, they had the sleep and then they on purpose make them be wakeful and compare their reactions while driving with the people who have a different levels of alcohol level. And with 17 hours sustained wakefulness, which actually most of us do, like if you get up and go to work at 6 o'clock and if you're late like 11, 12 o'clock, that equals, your reaction equals to having a blood level of 0.05. And if you're 24 hours sustained wakefulness produces performance impairment of 0.10%. And again, like, you know, going back to my residency, with, you know, normal call is like 30 hours and then you have to drive home. With next, like how we can address if we are in that category that like we are at home, the room is up there, we have the time, but we cannot fall asleep. So I divide it into a couple of areas. First is look at if there is something in excess that we have to remove. Is there something that's missing and we need to add? And also I'll review like the 3-4 most common sleep disorders that really need to be evaluated by a specialist. So first I will start with what you want to remove. And these are medications like noise, and people sometimes are sleeping during daytime or snoozing in front of TVs for an hour or two and then go to bed and say, no, I cannot fall asleep. So with the next slide, I want to review a couple of medications. It's one of the things that can affect your sleep. People who take, so the first one is diuretics, most commonly given for high blood pressure. So, you know, the goal of the diuretics is to make you go to the bathroom. So if you take it in the evening, if you go to the bathroom 3, 4, 5 times at night, it means that the medication is working, but instead, so, you know, make sure if you take that, I move it to the morning, take it in the morning. So until the evening, you don't have to get up and go to the bathroom. The second one is beta blocker. Things, another medication for blood pressure, like for example, atenolol, metoprolol, propranolol. They do cause some insomnia, nighttime awakening, nightmares. So if that happens again, try to get them in the morning. Clonidine is it's the opposite way. It can cause drowsiness. So if it causes drowsiness, instead of taking in the morning, we do recommend take it in the evening. Medications for anxiety and depression, you know, for many people, they work wonders, they work great, but they might cause daytime fatigue and sleepiness the next day. Thyroid hormone, again, thyroid hormones are made to up your metabolism. So if you take them late, they can make you actually have difficulty sleeping. As a general rule, we anyway recommend all thyroid medications to be taken in the morning before breakfast on an empty stomach. Nicotine patch, again, nicotine, it's stimulant, so the same as the cigarettes. If you put a patch, higher dose, it can lead to insomnia. And steroids, so some of us may have taken steroids for asthma for 5 days, some might have taken for other reasons, and many people like feel that kind of like jitterness, you know, like too much energy, cannot sleep during the time that they take it. And again, so once you know that's the reason, let's say if you take prednisone for 5 days for asthma, if you know that's what it is, you don't need an additional workup. You just know it's from the medication. Make sure you take it in the morning, and you know it will slowly go away once you don't need any more of the prednisone. So with this one, we have a question.
Yeah, so we do have a poll that we're going to ask all of you to take today. But before we do that, if you have any questions, please go ahead and enter those into the chat or into the question box. We do have one question, Dr. Todorov, and you had mentioned that we have, it's good to get somewhere between like that 7 to 9 hours of sleep. Can that sleep be interrupted? So if I would get 4 hours here, 2 hours here, you know, or does it really need to be continuous sleep to be most effective?
Yeah, so truly this is the recommendation for sleeping hours during nighttime. So that doesn't include like if you're napping for 2 hours here and there. For people who have a true chronic insomnia, you know, the one that we remember mentioned that is 3 times a week for 3 months, for them we actually advise sleep deprivation, so not sleeping during daytime at all, and then go to sleep at night, so like OD sleep is at night. And I get this question sometime about the power sleep. You know, you go and sleep for 30 minutes. Again, if you don't have a problem sleeping, power sleep, it's amazing things if it doesn't affect your sleep. So it may be a great way to be energized.
Great. Well, let's go ahead and take our polling question. So we're going to ask the audience to participate. And here's the question: which drink has the highest amount of caffeine? So you'll see it pop up on your screen. Do you think it's espresso, cold brew coffee, green tea, or hibiscus tea? Go ahead and choose one of those, and we'll actually see the results. And Dr. Todorov can talk to that a little bit. So we'll give you just a few more seconds. All right, let's see what those results are. So people thought that it was 41% for espresso. And doctor, what would you say is the right answer there?
Yeah, and you can move to the next slide. Actually, that was a surprise to me. I had to write an article, so I kind of like, you know, was researching and looking. So truly the espresso is the lowest one. So it has around 40 micrograms, you know, like if it's a one shot. Then much more is the brewed one, like around between 80 and 120. And it was interesting, like, you know, like how you can order a short one and long one. So I never knew the difference. So I always thought the long one is you put more water, until I had a friend, we went and she said like, oh, I want like a short coffee, but you can put an extra hot water. And I was like, but that's a long one. And then I went actually to read, and the long one is the coffee stays longer, so the amount of caffeine in the longer coffee, it's much more compared to the short one. So that means like the small and the large one. But the cold brew, it's actually the winner. As you can see, there is a 200 milligram. I have had it only once, you know, just from curiosity. I ordered it in the coffee shop. It was like strong. So cold brew, it's just like you put the coffee overnight, 24 hours, and then you drink it. The green tea and black tea do have a caffeine, but it's less than the espresso or the brew coffee. I did put on the list also the hibiscus tea, because hibiscus tea is herbal tea. So most of the herbal tea, like, you know, chamomile, hibiscus tea, peppermint tea, you know, ginger tea, do not have a caffeine. And I do recommend, for example, things like chamomile tea before bedtime for stress, anxiety. And I put hibiscus because hibiscus I do recommend a lot for people with high blood pressure. There is like a meta-analysis, look at 5 different studies, and people who drink 2 cups of strong hibiscus tea and compare them to taking a blood pressure pill, and it was the same. So with people with tendency to high blood pressure, I ask them to avoid the caffeine and instead drink, hibiscus tea, and also if stress is involved, chamomile tea. And I did look on internet, the common drinks that you can buy, Red Bull, Monster, and I've never heard of cocaine, but when I looked on internet, I found it has a 280 milligrams of caffeine, and I actually found one that has 350, but it was very uncommon. I didn't include it. So next slide, please. While we are moving to the next slide, people are divided. Now we have even genetic testing to see if you're a fast metabolizer or a small metabolizer of the coffee. So maybe 75% of the people are the fast metabolizer. What does it mean? Like if I drink 3, 4, 5 coffees, I will be able to fall asleep and no problem. Slow metabolizer is like, even 1 or 2 cups of coffee, or any coffee after 12 may actually affect your sleep. And again, you don't need the genetic testing. You just get one of these cold brew and you know which part are you if you cannot sleep. So the next after the caffeine is like technology, electronics. So that was an interesting study, 2013. They pretty much called the people at home and they asked them, do you use technology 1 hour before bedtime, and what kind of technology that is? Like, is it electronics? Is it like games? Is it a TV? So what the conclusion was that, like 90% use electronics and TV was most of them. And then we do divide the electronics in the interactive and just passive. For example, if I'm just watching TV, and especially old movie that I know what's happening, that's a pretty passive. But if I'm playing a game, if I'm on social media, if I'm posting on, social media, reading the news, that's much more interactive. The more interactive one wakes us more because we're thinking and doing stuff compared to the passive, just watching TV. Next slide. And
yeah, Doctor, could we actually interject? We did get a couple more questions, and it seems like this might be a good time to ask.
Yeah.
Somebody was saying, my husband falls asleep practically instantaneously when he sits down after having worked all day. She says she's jealous, but it worries her. Is that normal?
Is he able to sleep the whole night? So the thing is, like, again, is if it's a sleep deprivation, and you're working all day, you go to sleep and you sleep until the morning and you don't have any problems, that's fine. But we'll talk a little bit later. If he's overweight, snoring, grasping for air, so that might be, a sign for a sleep apnea. And again, is he able to go throughout the day without a fatigue and finish everything? Versus if you tell me like he's driving and falling asleep, that's a different story. But going to bed and falling asleep, that's perfect actually. So this is again, some very, very small studies where they compared, people reading an actual paper book versus reading the same book on the e-reader. And on the next slide, you'll see it was, I think, was only 14 people. Next slide. It was 12 volunteers. So they asked them to read a book for 4 hours, or again, one was the regular book, the other was the ebook. And you would say, like, who reads the ebook or regular book for 4 hours? The reason they chose it is because they looked at how long people spend on electronics, specifically adolescent, before bedtime, and it was the average 7 hours and a half. So pretty much like all the time after school, because they have to do a homework. That was even before COVID time. So now it's probably all the time because the school and everything is online. So on the next slide, what the result shows was that the people who are using the electronics, and even though like the room was very dark, so everything was kind of like perfect for sleep, it shows that prolongs the time it takes to fall asleep. The people who are on the ebook compared to the regular book, delays the circadian clock, suppresses the levels of the sleep promoting hormone melatonin, so they actually measure the melatonin, prolong the time it takes to fall asleep, and reduces the amount of REM sleep, and reduces the alertness on the following morning. Next slide. That was an interesting study, and in first was kind of like shocking to me, but if I can see and ask you to raise hands, you'll probably agree with me. So the 46% of people, answer on this survey that they sleep on with their light on, and like we know we produce melatonin when the light is, the room has to be dark, but also 73% of people have TV in the bedroom. And again, I think that was a study done 2012. If I do it right now, I'll more likely ask, do you have a phone or electronics in the bedroom? Because that number is much higher. And 11% of people actually sleep with their TV completely on the whole night. And again, I see a lot of times, wife comes in, she has problems sleeping. So, question for you guys, is that insomnia, or this is the sleep deprivation? So the husband likes to sleep with the TV on, and it's too, it's loud, it's there is a light, and you cannot fall asleep. So that's truly not chronic insomnia that we need to treat with medication or pills, but it's truly like changing the environment. If you need to, in the other room where it's like dark and cold, and you have everything needed to sleep. And actually, I read a study, and I do not remember the exact number, but I think more than 50% of the couple sleep in a different room, just to accommodate that difference is the noise and time. And also some people use fan. In that, I think 5% of people said that they use a different type of white noise to keep them asleep during nighttime. Next slide. So exercise. So here is like, let's talk about what is missing. So that was like what we have to remove, like the electronics, the medications, light that bothers us. So in the next two slides, there is two different studies that, people who do have problems sleeping and they're overweight, they ask them to exercise 150, in this first study, 150 minutes a week, which is around 30 minutes a day, which is like the general recommendations for exercise. At the end of the studies, they looked at how people are sleeping, they grade themselves, they show that there is a decreased symptom severity by 4 points. So they asked them a lot of questions, decrease the anxiety and depression, but there is no change in the daytime fatigue. On the next slide, it's a different study that was from Finland. Again, 45 overweight to obese men, specifically with chronic insomnia. They were included in the aerobic sessions, 30-60 times 60 minutes for 1 to 5 sessions. They were whenever they're able to join in for 6 months. And also the conclusion was that in 6 months, the aerobic exercise can improve sleep, mainly by mitigating the difficulty of initiating sleep among the overweight obese men with chronic insomnia. So again, that affect the time between going to bed and falling asleep. So that's initiation of the sleep. But I didn't think that changed how long you're actually sleeping. Next slide, please. So exercise is not just exercise in sleep, but also think of exercise and happiness. So that study in 2017 was looking like, are people who exercise happier? And the result shows that yes. So there was a correlation. So that's another benefit of exercising. Longevity is another thing. So this was again meta-analysis, meaning like they put all the studies that looked at longevity and sleep, and what they concluded at the end, that people who are exercising 150 minutes, which is again 30 minutes 5 days a week, but that was vigorous or moderate exercise. So again, think of playing tennis, running, Zumba, when your heart rate is going up and you cannot talk. So that was correlated with 14% decrease relative mortality. If you exercise 300 minutes a week, it was 26% decrease. And they even had like a smaller group that was an hour and a half a day, 5 days a week. That was correlated with almost 40%. But they didn't do even further, because who does an hour and a half of heavy exercise every day? And next slide. So again, the it's good to think of high-level aerobic exercise, but again, we have to be realistic and start where we are. For most people, I do recommend doing 10,000 steps a day, and that's our goal in Cleveland Clinic. Actually, if we're in a normal weight, if we do the 10,000 step, number cholesterol, blood sugar, we actually get 30% decrease in our health insurance premiums that we pay. So again, that's how you stimulate lifestyle changes. Have a body. So people who have a body are more likely to exercise because, you know, you ask like, oh, did you do your steps today? Did you exercise? Also, keep a diary. If you have a back pain, so doing a stationary bike, just walking, it's much better than doing a treadmill or the step machines or anything that includes jumping. Swimming is great. I know most of the gyms are closed, but swimming is great. And also for back pain, you know, Tai Chi, chair yoga, and I'll talk about that later. But truly, the best exercise is the one that you actually do. It can be dancing, walking, anything that you enjoy doing. Next slide. So with this, I'll switch to mindfulness, and I'll walk you through a couple of them because stress and sleeps are very, very connected. Most people say like my mind doesn't shut down when I go to bed, or I wake up and I'm like, oh, I haven't done that note for the patient, I didn't answer that message. So you're kind of like trying to write it down and if possible and go fall asleep, and then you can do it in the morning. So I'll share with you a couple of ways you can work on your mindfulness, and that's very, very useful now, you know, election, COVID, you know, winter coming and so on. So I'll walk you through the deep breathing exercises, listening to guided meditation, practice mindfulness, read a book, or listen to a music so you know yourself which of these relaxes you. Keep a gratitude journal. So gratitude journal is writing 3 great things that happen to you every day. And so, for example, I'm grateful for the weather. I'm grateful that I woke up today and nothing hurts. You know, I usually put my 10,000 step into the gratitude journal. Do gentle walk, yoga or Tai Chi. So the next slide, I'll walk you through a deep breathing exercise, and if you want, we can do it together. And I learned it with Dr. Andrew Weil, you know, when I did the fellowship in integrative medicine training. He has a great book on that. But pretty much 4-7-8 is 4 seconds is the deep breath in through the nose, 7 seconds it's hold the breath, and then 8 seconds it's exhale. And he suggests to do that twice a day, 4 times. So that's around 30 seconds. So it's not that much time consuming. So let's practice it twice. So let's first exhale, and then we're going to take a deep breath in, and while you're doing that through the nose, think of if you're smelling the rose, it's like 1, 2, 3, 4, and then hold for 7 seconds, and then blow out through your mouth if you're blowing a candle. And also you want to see like your tummy kind of getting like almost like empty. So again, try it one more time, and this time you can place the tip of the tongue against the ridge behind the teeth when you're taking a deep breath in. Like take a deep breath in again, and then hold, and then blow if you're blowing a candle as much as you can for 8. So pretty much the exhale should be longer. And again, if you do that twice a day for 4 times, if you're in stressful situation, you can use that. So I have people say like, oh, you know, I had to visit my mom in the nursing home, or I have to visit somebody in the hospital, so I'm kind of stressed, so, and I don't want to show my stressfulness, so I take a deep breath before I walk into the room, or I have a presentation, or I have to talk with a new client, and I kind of between clients, I want to kind of like make sure I leave the previous problem and I'm completely committed to the new conversation. Next slide, please. So there is a lot of talk about guided meditation, and I put here the first one is app. There is a lot of apps that you can use. For example, Mindfulness Moments is a Cleveland Clinic one. It's free. You can download it in your phone. We also have a lot of guided meditation on our Cleveland Clinic Department of Wellness website, and I put the link there. There is another one called Insight Timer. It's not a Cleveland Clinic one, but it has 60,000 guided meditation. It's free, and you can choose 1 minute, 3 minutes, 5 minutes, 1 hour. Also, you can choose the topic, sleep, stress. They have the one for kids, and also you can choose just they have like music or natural sounds. I have a lot of people coming back and saying they sleep on thunderstorm, for example. So you have to find what is that thing that helps you. Next slide, please. So mindfulness. So again, guided meditation is like, you know, you're laying down, you're listening, somebody's saying, close your eyes, imagine your happy place, and so on. Mindfulness, it's simply sitting, can be for 1 minute, and being fully present at the current moment without being judgmental. So for example, right now, you know, like I'm sitting and I'm listening to the lecture and I'm allowing myself to listen. And even if a lot of thoughts are coming, I need to do my laundry, I need to finish my emails, I have to answer to this email during the lecture, just gently say like, I will allow myself to have that 1 minute that I will enjoy the minute. And mindfulness can simply be, I'm driving the car and I'm kind of like awake and looking what's happening around. So we all have that experience. You drive home and you kind of wake up in your home and you didn't notice, like when you were driving, like was there people, what is the color of the leaves right now, is there flowers on the way, you know, and so on. So that will show you that you're completely out when you are driving. Next slide, please. So again, mindfulness, you don't need anything. You just can say like, I'm in this room, I'm looking around, I'm looking at the ceiling, and I can feel like my chair touching me, but it's again being present. Another two things that I saw and I heard that I liked is like a reverse bucket list. So, you know, we all heard of bucket list that we say like, okay, wow, I want to climb the highest mountain, I want to jump from the airplane. And, you know, if we don't do this thing, we can kind of get disappointed. But while going through life, we do other things that we never imagined we'll do. Like, for example, you know, like, you know, I'll go to, you know, like I'll run half a marathon or like 5K. And, you know, I did it because the kids at school did it and you have to do it with them, but it was never on your bucket list, for example. Or I will, you know, like I will be able to, you know, hike for 3 hours in a row, whatever that is. And so once you achieve it, you can put it there. And the other one is create a vision board. So vision board is like, we did it like here in a clinic, you know, the nurses brought like, you know, 30 magazines, so we were out cutting, and you put on the vision board what you want to achieve, and that visualization and making you kind of touch it, see it, the color, where it is, help you, you know, put the goal, and then you slowly get to this goal. And any step you do toward this goal decrease your anxiety. So you're making the first step. So next slide, please. Again, be thankful, be grateful. So that's the gratitude journal. So say thank you to the 3 people that contributed today. And I want to say thank you to Michelle. Like, I mean, the presentation looks amazing. The connection is great today. So again, we always worry about things like that. Thank you for taking a time ahead of time to log in and make sure everything works. So next slide, please. So another 2 resources that I can share with you are chair yoga and Tai Chi. Both of them, I more count them toward mindfulness and relaxation than like, you know, high vigorous exercise. We do have 5 Tai Chi videos that, during the lockdown, our acupuncturists tape themselves, and they're both Tai Chi certified. Again, it's free it's on the website. You can log in and practice at any time. Also, we do have a whole 1 hour of chair yoga, and it's a lot of like stretching, and especially for people who have a sedentary time, work environment with the back pain, neck pain, they might want to do that. And they're kind of simply like moving the shoulders, moving the neck, turning one side, turning the other side, and stretching for the lower back. Next slide, please. And also on our website, we do have throughout the week a couple of every week free yoga sessions, guided meditation sessions. We have one lecture by a physician or chiropractor or nutritionist once a month, and we have our cook, actually Jim Perko is doing culinary demonstrations once a week, and they're all free. You just need to sign up for the webinar. Again, food. So we might not correlate food with sleep, other than caffeine, but actually people who do have, let's say, acid reflux know what I'm talking about. If you eat a large meal or eat just before bedtime, or let's say you eat like chocolate before bedtime and then you're awake, you might think of like, okay, is that the coffee that is there? Or people don't realize the green tea has coffee and drink it at that time. So, but many food can be inflammatory, and the things I want to stress we need to eat more is fruits and vegetables. And again, that can be gratefulness and things that you put as a goal. It's like, okay, I'll eat 2 fruits every day and 2 vegetables, for example. Other things are eating legumes, which I'm a big proponent, like beans, lentil, garbanzo beans. They're full with fiber, full with protein, and the blood sugar doesn't raise after eating. So it's very good for anybody that has like, diabetes, high blood pressure, want to lose weight and feel full. Nuts are a great source of omega. Also, like think of the salads. Many times we put with all good healthy vegetables, and we put a very heavy dressing with everything. So just simply put an olive oil and vinegar, which is part of the Mediterranean diet. It's very healthy. The next slide is the things that you kind of want to avoid. Things you want to avoid is the ultra processed food. And how I define ultra processed food is a food that has label that with more than 5 ingredients that you cannot pronounce, food that doesn't spoil in the next 6 months, 1 year, 2 years. For example, take an oatmeal. If you get the instant oatmeal, if it's something that you just pour like a water, that's like completely processed, fiber is taken away. If you get like a rolled oats, it's a lot of the fiber is there. But if you get the steel cut oats, you have to boil that. It means it has the most of the fiber. Limit processed food and processed meat. Replace the refined grains with the whole grains. So again, bread, it's made from flour, so refined grains. Instead, if you put like some quinoa, some brown rice, some beans, lentils again, and you put some vegetables on top of it, like stir fry, it's a great way to add more grains. And again, anything that you cook at home is better than anything you eat out, because you control what's in. For example, think of mocha frappuccino, like might have up to 11 spoons of sugar inside, versus if you do it at home, you never put 11 spoons of sugar. Some pasta sauces have up to 12 spoons of sugar in one serving. So again, a lot of hidden sugars there. So next slide, please. So there is some specific foods that people did studies and how they are affecting sleep. So I found 2 studies with the tart cherry. One was 2 cups of tart cherry juice was given to older adults, and I think that was people above age 70. It actually increased their sleep with 85 minutes, which was pretty impressive. In another study was again given the tart cherry juice, and they measured the melatonin, the sleep duration, and the sleep quality, and all 3 of them has increased. It's next slide, please. It's very difficult to find tart cherry juice without added sugars, and even the tart cherry now you can find it in the freezer, but it's not like kind of like easy to find that tart cherry. So I found another one which is actually much more easier to do, like the 2 kiwi fruits. So they did a 4 weeks, 24 adults consumed 2 kiwis 1 hour before bedtime, and at the end of the study they said that they fall asleep 42% more quickly compared when they were not taking the kiwi fruits, and their total sleep time increased by 13%. Also, kiwi and constipation, there was a different study, so it's a great choice if you also have constipation. Now with COVID, you know, like there is a more of research is saying people who are low on vitamin C and zinc are more prone to have complications. So kiwi, it's one of the fruit that is the highest on vitamin C. So again, getting 2 kiwis a day, you'll get your vitamin C. When the zinc you can get from the nuts, which is again a great source of omega. Again, nuts are also a rich source of melatonin, in addition to being a rich source of zinc. For example, pistachios, they were saying that like 2 pistachios have like a 10 milligrams of melatonin in one study. So again, thinking of having a kiwi, which is a fruit, but it can increase the blood sugar with some pistachios or almonds and walnuts. It's a great snack if you want to eat something before bedtime. Next slide. Again, look at treat what is treatable, because if there is conditions like sleep apnea, chronic insomnia, narcolepsy, restless leg syndrome, this needs to be treated and this needs to be evaluated. If you cannot sleep because you have anxiety or you have a depression, so typical for depression, and you fall asleep and you wake up in 3, 4, you know, between 2 and 4 o'clock in the morning, and you kind of start thinking about different things. And I didn't mention alcohol in the food, but again, many people drink alcohol to help them fall asleep, but it's very typical. Alcohol goes away in 3, 4 hours and usually cause you to wake up in 3, 4 hours later. Acid reflux, again, you know, taking diuretics at night, or, you know, you have a prostate problem that you need to wake up 3, 4, 5 times at night, having a chronic pain and trying to find the right position, you need to change the position. So you might need to address pain in order to improve the sleep, having a hot flashes and so on. Next slide, please.
And I think here's where we have another polling question, but before we go there, we do have a few more questions, Dr. Fodorov. So one is, and it's perfect based on what you've been talking about. One says, I take a sleep aid, so 25 milligrams of Benadryl. I have no difficulty falling asleep. However, I seem to wake up, so this will help me get back to sleep. Is that detrimental?
So Benadryl is probably not the best one, because it can cause like dry mouth, constipation, and especially it's on the list of the drugs that we don't want to give, you know, it depends on the age. So above age 65, it's one of the medication we avoid. And the reason is like because of the dry mouth in addition of everything else. It also can cause drowsiness. We all know, like when we have allergies, so when they say no non-drowsy allergy medication, that means Claritin. And if they say drowsy, that means Benadryl. So we kind of use the side effects of Benadryl to sleep. So I'll walk you through some of the supplements that you can try instead, and like sleep hygiene, and so on. And another thing you can try, just take one of these guided meditations if you wake up in the middle of the night and kind of put the guided meditation. Also, melatonin that I would talk, it's a short acting and long acting melatonin. The short acting is works in the next 4 hours. So if you wake up at 2 o'clock and you have 4 hours to sleep, you might try a small dose, 0.3 melatonin. And if you're waking up, you might just take in the evening the long acting, so it covers you so you don't wake up.
Great, thank you. And here's another one. You had just mentioned a little bit about people that have sleep apnea. So here's one for us. It says, I had significant snoring. Sleep apnea test actually was negative. We started using a Himalayan salt lamp and my snoring has significantly improved. Have you seen this with others?
So I have a Himalayan light, you know, most of us actually has it here, but I haven't seen it for a sleep apnea per se. But people who are snoring, so, you know, losing weight can be helpful. One, position. So many times if you turn on the back, kind of snoring, and you're, the second person in the room turns you on the side and you stop snoring. Or, sometimes you snore when you're like overly exhausted, like in a specific position, and so on. But again, if you have been tested, the person has been tested, so it's good to know that it's not a sleep apnea.
And then this one was kind of back to the cherry juice that they were asking. They said, why the cherry juice versus like a cranberry? Doesn't that have a lot of benefits too?
I think it has a melatonin, like it's based on it. But it's, again, I haven't seen a study that's showing the cranberry juice works.
More of the cherry.
Yeah, but the tart cherry, truly, I mean, I had patients that bought it like more like in the supplement stores, but they say it's like, I mean, it's really tart if you don't want to big concentration without added sugar. The one that you just buy in the store, like normally it has a lot of sugar and not enough. Yeah, I was excited. I was talking a lot, but not many people can. Yeah, it's not very practical. I think getting the kiwi, giving nuts, it's a much more practical, to get.
Yeah, I would agree with that.
Yeah, and it's expensive, there's farm here in Ohio. I went, you can pick up, I didn't went, I mean, I picked tomatoes and other things from there, but I remember the price was like $40, for the tart cherries.
Wow.
Per pound. Yeah.
Another question we have, what about using CBD oil to help with sleep? I know that that's been kind of a big thing probably within the last 12 months or so.
Yeah. That's a great question. I didn't even put it on my list on the supplements, because like right now I feel like CBD is a cure for everything, for sleep, for anxiety, and I, as a general rule, I do not recommend it, and I'll tell you why. So Dr. Roizen, who works in the wellness center in Dr. Oz, I think was last year, they went and bought like 60 bottles of CBD oil from 3 different states from a different stores, and they send it to see like how much CBD is actually in the bottle. So truly, I believe like the 31 of them was what it says on the bottle. It was much lower or nothing. And then there was one that was just the THC without the CBD, and then there was others 20 something that has both THC and CBD. So and there was no correlation with the company name, the location that bought it. So some people say it works, so maybe they were that lucky one to get that 1 or 2 bottles that what says on the bottle, and that's what's inside. So again, it's not regulated, so truly you don't know what you're getting.
So I guess along those lines, another question too that just came in, since you're talking about the CBD. So I guess they'd love to know what your feelings are just on the medical marijuana or cannabis. Does that help with insomnia now too?
Some people feel improvement, but again, they have to be supervised, and the medical marijuana, and again, you're probably treating the anxiety that caused the the insomnia, and again, here we don't prescribe marijuana, but like there's so many more things that we can offer. So for example, we do have 8 holistic psychotherapy, and they work with guided meditation, hypnosis, again, to address that reasons for anxiety, like childhood traumas, PTSD, stress, and so on. We have acupuncture that also has been shown to be like improving the symptoms. Exercise, as I mentioned, just simply adding the exercise, you probably get the same benefit as getting any other supplements. And again, exercise, the caveat is you want to exercise. People who exercise daily improve sleep, but you do not want to do vigorous exercise 3 hours before bedtime. So we all know, like if I go to the gym at 8 o'clock, and then it might take me until 11 to fall asleep. And again, that's not insomnia. I just know that I'm high from the exercise, and it just takes me some time. The exercise that helps you fall asleep is, yoga, again, Tai Chi, something nice, relaxing, walk outside. Yeah, so again, I would steer people to try other things in conjunction also, like again, guided meditation, food also, again, avoiding the caffeine.
And then you had mentioned a little bit too about some of the supplements. Somebody was also asking about melatonin. Is it really safe to take that every day, or should that be something you try to moderate?
So there is no studies that is not safe. And actually, when we finish this question, I think there is 2 slides on melatonin, so we can answer at that time.
Perfect. Well, then let's go ahead and take the poll. So asking the audience again to participate. Which of the following statements is incorrect? So select one. So is it sleep apnea is more common in men than women? 63% of people who are obese have sleep apnea. 15% weight loss can lead to reduced sleep apnea symptoms, or a sleep apnea study can only be done in a hospital setting. Which one of those statements is incorrect? So we'll poll the audience and see what they say. All right, let's see what everybody said. So 73%, Dr. Todorov, said that a sleep apnea study can only be done in a hospital. Is that incorrect?
Yeah, that's incorrect. Yes, that is incorrect. So it can be done both at home and in the hospital. So they have certain criteria who can do it at home and who can do it in the hospital. But again, I can see you to raise the hands, but I'm sure there is no person that doesn't know somebody who used the CPAP, or have a friend or relatives that are using. It's so prevalent, and it's much men at much higher risk, and probably because of the weight. Also, we know that with increasing the weight, the risk for sleep apnea increase. And I did have people who are losing like significant amount of weight, and then the sleep apnea resolves and they don't need to use the CPAP anymore. And that's kind of one of the reasons many people even go on the weight loss journey. And if you do have a CPAP, please use it. If you don't, kind of work up with some people say I cannot use it, but they can change the setting, the tubing. There's different ones, there are newer ones, smaller. So until you find something that might be working for you. But again, losing weight, it's a big contributor to that. Gaining weight is a big contributor, and losing weight can help you lose, resolve the CPAP, the sleep apnea. So next slide. So again, the chronic insomnia disorder is, remember that when you cannot sleep more than 3 nights for more than 3 months. So this one, really the best treatment is what we call cognitive behavior therapy for insomnia, and that's offered through the Sleep Center. And that includes everything we just taught, like, the sleep, like routine before bedtime, sleep restriction. So these are the people who are asked not to sleep during daytime. Many of them are kind of sleeping daytime but not sleeping at night, so just kind of move that one. Do something like meditation, deep breathing exercise, something to relax. And they do cognitive behavior therapy, and they work with them, like even I didn't even touch that issue. Like many people kind of wake up and they feel good, and they look at their phone because they're using the apps for sleep and say, oh, my app says I don't sleep well, and that kind of like detrimental. So they really don't want you to use like the typical apps that are on the phone. Next slide, please. It's good to keep sleep diary, but not so I can skip the restless leg syndrome and narcolepsy. That's another disease that you want to see a physician. Again, like moving your leg fast, and we can move since we have a little time, and I think the interest is in the supplements. Again, for acid reflux, keep the head of the bed elevated. Don't eat in the last 2-3 hours. Avoid anything that's spicy. Orange juice, tomato sauce, fatty food, and dairy, like it's a fatty food, so that causes more symptoms. Eat slowly and mindfully. Truly, in one study they said if we eat slowly, probably we would not have the acid reflux, because you have time to mix the food with the saliva. Then you have, the stomach is ready for you. Also, chamomile tea and licorice tea is good for acid reflux. And again, lose weight if that's a contributor. Next slide. Anxiety and depression, again, exercise, eating Mediterranean style. Next slide. chronic pain, again, if we wake up from chronic pain, address the chronic pain, you know, like, and there's many ways to address it, like acupuncture, manual therapies, based where the pain is. We can work with some herbs and supplements, and so on. Next slide. You know, joint, you know, like ortho can do steroid injection, knee replacement, and so on. So herbs and botanicals. So here, 19% of Americans do use botanical supplements. On the bottom, I did put like 3 different organizations that can take the actual bottle, check what's on the bottle, and certify that what you're actually buying is there, because they don't go through the Food and Drug Administration. So either look for some that has that label. Also, I look at consumerlab.org. So again, they go and buy different and see which one is it has what it says it's on the bottle. And many times if I see a good trial, like, you know, the trials that I showed you earlier, I try to get exactly the same brand, because that brand shows that there is efficacy. It doesn't mean that the others are the same quantity. Next slide, please. So this one is like the herbal tea. This is my preferred ways to get the herbs. Any combination of sleepy teas, like, you know, valerian root, especially if you have anxiety, passion flower, chamomile, hops, lemon balm. And next slide. And I think that's the so the valerian is like I like valerian a lot. In Europe is used a lot. There is 18 different randomized control trials showing that valerian it does help in insomnia, when insomnia is correlated with stress, anxiety, jitterness. So if you cannot sleep because you're anxious, then is the right person that will benefit. Next slide, please. The valerian takes around 3 weeks to work, so it's not like one of these like melatonin, you take it will work tonight, but take it for 2-3 weeks before you decide if it's working or not. And pretty much with all supplements, I do recommend to avoid in pregnancy and breastfeeding, but otherwise safety. It's pretty safe. Next slide, please. So lemon balm is another one, and again, most of the herbal teas that you buy will have it. Next one. Hops, it's you know, again, it's you can, it's part of many teas that you can drink. It's hops is what we make beer from. Next slide, please. But it has been studied for that. Magnesium, it's actually one of my favorites. So if you have anxiety, constipation, difficulty sleeping, magnesium is my preferred compared to melatonin and others. Next slide, probably you can, it's probably there, 200 to 400 milligrams before bedtime, 30 minutes. It helps also if you have a restless leg syndrome, muscle cramps. If you have a constipation, choose magnesium citrate or magnesium oxide. Magnesium citrate base absorbed like the strongest magnesium oxide, but can cause some cramps, but strongest for constipation. If you more on the diarrhea side or neutral bowel movement, then you choose magnesium glycinate or chelate. And again, I put there the contraindication, and specifically if you have, like, you know, kidney problems, avoid it. Next slide. So melatonin, again, many studies, and decrease the sleep onset latency, increase the total sleep time, and improve overall sleep quality, and less efficacious than prescription medications, but less side effects compared to prescription medications. Next slide, please. Kind of common side effects that I've seen is kind of vivid dreams, confusion, and sometimes fatigue and sleepiness. This is one of these supplements that the big more doesn't mean better. I start with 0.3 milligrams 30 minutes before bedtimes, and many times that's enough, and especially in elderly. And again, you just put it under the tank, 0.3 milligrams, and if you need, you can increase. And again, this is my preferred one if you're traveling, let's say overseas, and if you need to, or if you are working at night, because again, you're coming, it's light, you don't produce melatonin, so that might help you. Shift workers. Next slide. So again, I put here one case. You can read it, but since we're out of time, but pretty much a patient came in, and you can see like she was taking like ashwagandha, valerian root, ginger, thiamine, GABA, Kava, rhodiola, but was going in bed in 1 o'clock, and also she was taking strong medications like trazodone 100, like Ativan, clonazepam, and so on. So what we did, we slowly, and you can move through the next slide, but slowly move her bedtime from 1 o'clock to 12 o'clock to 11 o'clock. We added some breathing exercises. She started doing like an hour before bedtime, a sleep routine. She added first like very mild stretching kind of yoga before bedtime, then add walking, and pretty much you can move to the next slide and the next slide. And next slide again, she did guided meditation. So every time I added new things like, okay, let's do diet. So she was able to actually to decrease the trazodone and then stop it. The next slide. So this one was cut on half. So she was already like completely off trazodone, and she was able to sleep 8 hours before she was needing 11, 12 hours, and she was waking up unrested. And I completely stopped all her supplements. We just left just the valerian and the magnesium, I think was the two. Next slide. So again, so what we talked was like to look at your sleep, keep a diary, see what might be affecting your sleep, and remove it, avoid it, be alert what's happening, and then add what is missing, like stress management, healthy food, have a sleep ritual, exercise, and then if there is a comorbidities, go be checked, and again treat them. Like again, if it pain wakes you up, acid reflux keeps you up, sleep apnea, you need to address them. So I think that's with that. I want to thank you for and thank you for the questions. I hope there is more questions.
Yeah, so I mean, just in general, Dr. Todorov, thank you so much. This has been amazing. I think that one of the biggest takeaways I had was just the 12%. If somebody could say, I can increase your life by 12%, here's a magic pill, sleep, who would have ever thought? That's unbelievable. I think the important thing that hopefully you all will take away today is, make sure that you're taking charge of your overall health, whether that be your physical, mental, or financial. And I think to your point, there's no better way than the now. Take those steps now. So if you would maybe leave the audience today with maybe 1 or 2 points of where to start, what would that be?
Yeah. So again, take one step at a time. Don't overwhelm yourself. So if you say like, okay, I will add walking 20 minutes before bedtime, do that for a week, and then you can say, okay, I'll add one fruit, and let that be kiwi or whatever. Like you add that on, okay, and then congratulate yourself. That's a gratitude journal, because the more you feel confident to achieve it, and you're not overwhelmed. And when I talk about food or ultra processed, don't go and throw that's what it's home, but it's just the next time you cook, then make a healthy choice, and slowly make the changes. Yeah,
that's great. Well, thank you again for being our guest speaker today. If you all would like to reach out or try to seek out Dr. Todorov's help with sleep, you can certainly find her at the Cleveland Clinic. I know that if you do a search online, I think they can find you. Is that right?
Yeah. Oh, yes, absolutely.
That's great. And, as always, Luma and Fairport Wealth are here if you all have any questions about your overall wealth guidance. And if you find that you were interested in this, please let your friends and family know. We continue to try to bring different types of educational programs to you that we feel that might help you in your day-to-day. So again, thank you so much for attending, and we'll see you next time.